Our next slide gives us the 10 commonly missed HCC codes. Metastatic cancers and acute leukemia. It's really funny because leukemia is just leukemia unspecified is the lowest risk adjustment scored cancer. If you give specificity to the type of leukemia, it becomes one of the highest. And so that shows you how important specificity is. Let's see, anytime you have cancer that is active or has metastasized, by the time it moves, it risk adjusts very high. And it really changes the RAF score. The RAF score goes through the roof for those. Pressure ulcers, if there's not complete staging for them, then you're not going to be reimbursed. And pressure ulcers take forever for these patients to heal and compromise the patient. And they usually have other chronic conditions as comorbidities that caused that to happen. Severe hematological disorders, there's complex coding regarding them. Just look how many anemia pages you have in your manual. 10 pages for just anemia. It doesn't usually get covered a lot unless the patient gets put in the hospital and then they mention the patient has anemia. Cystic fibrosis, it's rare, but it is a chronic condition and it's often overlooked on the annual wellness visit unless the patient's got a problem. Atherosclerosis is so common, but when you have atherosclerosis with ulceration or gangrene, that is through the roof. So that's another one where specificity really counts. If you live long enough, you're going to get atherosclerosis. But again, ulcerations and death of that tissue is huge. And then respiratory dependence on tracheotomy statuses. So when a patient is on oxygen full time, that risk adjusts very high, as well as anybody having an artificial opening, any type of ostomy of any type. Tracheotomy is one that's overlooked, but also colonostomy. I don't want colonostomy. What am I trying? They have a stoma. Any stomas will risk adjust. So the next is the most commonly missed part 2, or is that the same? No, you just haven't changed the slide yet. Is that the same as the other one? On the next slide, Laureen? Are those 2 slides the same? Oh, there it is. There, you did it. No. Okay, so the tracheostomy, dependence, oxygen, ostomies, any artificial opening, urostomy, a lot of times that's overlooked. Transplant status, kidneys, but think of all the things that could be transplanted. So kidneys, we think about that because it's talked about. But you can have a liver transplant, a lung transplant. There are some other that stem cells and stuff like that. They are often confused as complications, and that's not what they are. Transplant status means that you're on medication for the rest of your life. And so you may be healthy and doing well, but it takes a lot of money to care for a transplant patient because of the pharmacy aspect and the possibility of other complications. Obesity, again, very common, often left off, but it complicates everything. You got to have a procedure and you're morbidly obese. And especially if it's like a spine surgery, they got to flip you around on the table or any orthopedic thing. That makes you more complex of a patient, and it usually exacerbates other conditions. Long-term use of insulin, diabetic medication, is extreme. Z79.4 is always overlooked and needs to be captured every year. So that ends us with risk adjustment.
Looking for medical coding, medical billing, and risk adjustment education? Learn more at cco.us.